We are very happy to be joined again by Debbie Lynn Toomey, the Tufts Injury Prevention Coordinator. Debbie, thank you so much for being here with us today.
Thank you, Carrie. And again, thank you to Thomas Crane Public Library and QATV for this partnership and allowing me to continue this outreach work on injury prevention for the older adults. The purpose of Aging Strong is to educate and empower older adults with resources, information that can help provide and give them a great, amazing quality of life. And so today the topic is on caregiving and more importantly, how to support them. And in doing my research for this program, I found very interesting statistics. According to the new AARP Home Community Preferences Survey, according to their data, 77% of adults 50 years and older want to age in place. That's great. And that's been a consistent data for the last decade. And as older adults age in place, they are going to need support. And in that could take a form of friends, families, neighbors. And so caregiving becomes this big, wonderful topic where people can, provide these kind of kind deeds or little tasks that they could do for the aging population. But what happens is when it becomes more and more demanding and becomes more regular, that's when burnout and compassion fatigue can happen. So today, I want to welcome Richard Shipp. He is my counterpart from Mass General Brigham, and he's the injury prevention coordinator there. And he wants to talk about how we can offer caregivers and how caregivers themselves can offer themselves self-care. So Richard, welcome.
Thank you, Debbie. Caregiving, I think is one of the most really studied aspects of healthcare. As you stated, the statistics are going up. People are wanting to age in place. And that being said, the caregiving role has taken on a whole different paradigm. People are actually focusing more on how to take care of their loved one in the home, but also getting all the stress that comes around looking after themselves as well, which we all know as we age with our partners, we're both going to be getting older and we're both going to be needing additional care. And while you're providing that additional care to your spouse, you need to make sure you're taking care of yourself too. And that's really what my presentation is going to be based on. There is a few things about other initiatives that we're working with, which are very based around caregivers as well. But we'll get into that very shortly. So a very brief overview of who I am. One of the downsides with this technology is that I cannot see you and I cannot see the comments. So I'm going to ask Debbie, if you see any comments pop up, if you can just let me know and I will most happily stop and answer any questions.
Will do.
So the Injury Prevention Outreach Coordinator that I began working with Mass General Brigham. As you may be aware, they did combine around about a year or so ago officially. We're only now seeing the true culmination, but we are now currently called Mass General Brigham. My role is actually based out of the Division of Trauma, Burn, and Surgical Care Unit, and we are required as a Level 1 trauma center to have an injury prevention professional similar to Debbie, and also provide that initiatives surrounding injury prevention, both within the hospital as well as doing outreach into the local community. A little bit about my background. I have been working in community health for over 20 years now. I am a caregiver myself. I have a child which has special needs, and I'm caregiving 24/7. So this is a subject that is very close to my heart. I'm very forward-focusing, but history-grounded. And what I mean with that is I look at the problems that we have currently and focus on what we've learned in the past and bring that back. There's sometimes no point of reinventing the wheel, but there is also a lot of things that we can be learned from by previous studies and previous initiatives. I jokingly say here that I'm goal-driven and battle-tested. What this basically is saying, I've worked in pretty much every avenue that you can imagine. I've worked in hospital settings. I've worked in local physicians' offices. I've worked in non-for-profits and also group homes. But also I've worked on the street as street advocacy and street healthcare. This area right here is really my ethos of what we should be doing within healthcare, which is really communicating, being as transparent as what we can be, and making sure that we do follow through. And initiatives like what this Debbie has developed really shows that follow through aspects. My goal within Mass General Brigham is to really present initiatives in a new and functioning way, focusing more on the mindfulness fashion and also for caregivers, as we were saying earlier. If people have not been aware, this is a really good infographic of what goes on through trauma recovery. Now, a lot of people see trauma as something that they may see on TV, like currently, unfortunately, what we're seeing in Ukraine. But trauma can be as anything which happens to a person, whether it be from a mental status or a physical status. This infographic, I really feel, shows very well what we can see after trauma and what really it means to be recovering from that. You've got the outer peel. You know, this is what people see on the outside. So say, for instance, you had a fall. People are going to see the bruising possibly, or they're going to see a scrape, and they're going to say, hey, are you okay? Did anything happen? And it really would be your choice to decide on whether you share that or not. Next, we see the squishy goo feelings. This is really everything that a person feels when they're actually going through the trauma itself. Now, this can be mental health symptoms. This can be somatic symptoms. This can be triggers, disassociation, and a lot of other variables that make that trauma very real and very realistic to what is happening to you personally. And lastly, there's the pit. These are traumatic memories, beliefs about how you are interacting with the world and how that is based in trauma or in shame. Now, this is something that we can work on, and this is something that we really develop a strategy to be able to help both yourself and the person who's giving you care also. Any questions currently?
No, just a comment. I can see from this nice illustration of the avocado and how a caregiver also can relate to some of these type of factors. On the outside, they might seem like they are fine, right? And maybe inside, they could have a many mixture of feelings of guilt and overwhelm and anger and just frustration and total mental exhaustion. And inside could be feelings of maybe resentment or feeling like they lost themselves along the way from taking care of somebody that they care about.
Most definitely. And the other thing which I like to use, because it's the avocado basis, if you can imagine when in the past people would say that you should bottle up your feelings and you should always keep them inside. This shows what happens when you do that. You bottle those feelings up and eventually it turns into a rock. And that's when people really start getting problems. We need to be able to get to areas and to be able to help before it gets to that pit point. Because once you get to the pit, then you need more intensive treatments to be able to kind of chip away at those feelings and the emotions and the resentment, unfortunately, they could come along with it. So this is where we come into some of the initiatives. And one of the things that we are working on right now is initiatives that are based for both caregiver as well as person who's actually receiving the intervention. One of the exciting ones that we're working on right now is something called Bingo Size. This actually initiative is worked out of Western Kentucky. It is a 10-week program that we're doing both in person and virtually. The reason I like this program for both caregivers and for the person it's actually focused for is it's a fun, engaging program. And it works on levels which does include the mental health aspect by providing the person tips and examples of how to work around with a partner as well as being on their own. This particular initiative is something we're rolling out and we're actually providing studies on currently. And if there is any interest in possibly looking at more information on this, I'd be happy to give more information at the end of the presentation. The next initiative I wanted to focus on is the Powerful Tools for Caregivers. This is the one which really is focused on today's presentation. It is a 6-week program. It is evidence-based, which means it has been rolled out many times before and proven to be an effective strategy to assist in the following outcomes. It has been proven to reduce stress. It develops an emotional management system for both the caregiver as well as the person who's getting care provided. It gives the caregivers self-confidence. Now, this self-confidence is not only in providing care for their loved one, but also how to talk to medical professionals. It gives them the ability to be able to develop strategies for what happens when they get overwhelmed. And it also gives them community resources that may be provided without cost or with minimal cost to both the carer or the caregiver. This particular partnership is actually through a company which I utilized before. I am a trainer for this. And if there is interest for developing a 6-week program for yourselves, I can most happily develop that for you with the library. Any thoughts or any theories on this particular initiative that I may be able to help clear up?
I'd like to, if you could just, I jotted down the components of this program. If you can just come off of screen share so we can start having our dialogue, because I do have some questions about first of all, how would this particular program reduce the stress of a caregiver? What are some skills or what are some aspects of this stress reduction component that can help benefit the caregiver now if they're watching it?
Well, the biggest one is open communication. Communication with other people within the same areas. Now, I can never say to someone that I know exactly how you feel, but we can talk about things which are similar. And that's one of the things which this particular initiative really focuses on. It's not trying to match what people are feeling. It's really trying to give them additional supports at the time with other people that are going through similar things. So what that means in a very kind of like nutshell effect is it gives the emotional support across a wider spectrum and also not within the local group. So if you may have a family member that you talk with, and you may talk to them about the caring, but you feel that they're really not getting that, what is really happening. Talking to someone who's not in your immediate environment can be very, very beneficial because you're sharing the experiences that you're having and their experiences can be shared as well. That is really where you start seeing, oh, well, maybe what they're doing, I could try in my situation, and vice versa.
Mm-hmm. That makes a lot of sense because sometimes the person who is requiring the care may not be aware, if they have dementia, that they require the care, or perhaps they're so deep into their the complexity of their condition that they're just not getting it, perhaps, or it's just totally beyond them, or they expect the care. And so as the caregiver, I could see how talking with another person in a non-judgmental way, in a safe space, to just kind of open up and just label your emotions and just kind of share what you're going through without feeling guilty, how important that is and how that can give other people in that support group permission to also share.
100%. And a lot of times caregivers do feel this guilt. It's an innate guilt that they feel they have to do what they're doing. One of the things which, again, this initiative encourages is telling your own story and creating your own narrative. So coming into these things, you may think, oh my goodness, I don't need this. This is kind of mine. I'm just supposed to do this because she's my wife or he's my husband. We find very quickly that's not something that is real. That is something that is put on yourself. And the idea is to be able to share that and find ways to be able to manage it more effectively. And also look at ways to identify when you're over your head, which is a very challenging thing for a caregiver to do.
Yeah, I'm sure it could. I mean, you mentioned that you're a caregiver to your daughter, and I'm in that space where I'm in the sandwich generation, where I have my own family, and I also have my two parents who I live very close to. And, you know, I'm getting into that wave, into that journey. Actually, I have been as a caregiver for both of them. And, you know, I could see how the spectrum of caregiving can really be so elaborate and complex. It could be that, just doing errands for them, or picking up medications, or taking them to doctor's office, or, you know, going grocery shopping, to, you know, more complex type caregiving. Maybe if they can't get out of bed, you know, helping them with their, you know, self-care. That can add more and more and more demand on the caregiver, and also will take up more and more time from them taking care of themselves and also the other people in their lives. And so as far as caregiver burnout, that is so real. That is so real. And it's so wonderful to have a program like the one that you're sharing with us, to be able to make that be known to the public, that there is something like that they could have this maybe hour or an hour and a half, that they could just kind of empty out and just be themselves and just kind of bounce ideas off. Because some people might say, is it just me? Or, you know, do other people feel like this too? What are your thoughts about that?
It's definitely building community, and that's the thing which I stress from the beginning. You are building your own community. And what I find when we've actually ran these programs in the past, people continue to talk afterwards. You know, they actually develop friendships, they develop camaraderie, really focused on the fact that they're dealing with a very difficult situation. And as you said, you're in a sandwich generation yourself. You're taking care of your parents. You know, sadly, I did that myself. I did the parent care, and I now see also with my daughter. And I think the funny thing, which I share with a lot of my groups, is I've done both caregiving professionally and personally. And it's very different. When you're doing it professionally, we can separate, and we can separate our minds. And I used to tell people all the time, the biggest thing between me providing care professionally and personally is a 4-letter word. And that 4-letter word is love. When I look at someone who is maybe challenging their behavior, maybe they do have dementia, maybe they're getting aggressive, you know, with their family members, I could work with that person professionally because I could separate, and I could still be able to maintain good caring. Now, when it's personal, that 4-letter word changes everything. And that's really this initiative drive, is to show that, yes, you do still care. You can still get angry. You can still get mad. You can still have the right to be very frustrated. But you're still going to be there because you know the next day you're going to wake up and you're going to do it all over again.
Right.
So, you know, love is a very strong word within healthcare. And I believe that is something that we need to stress a lot. You know, there is no shame in taking that breath, taking a step back, and asking for the help that you need.
Yeah. And so it's basically the message is it's okay not to be okay. Even if you are the caregiver, the person who's able to get themselves out of bed and get out of the house by themselves and do things for themselves. It's okay not to be okay, because, you know, it can get really tough trying to take care of somebody with love, for love, because of love, for 24/7. And as a caregiver or as caregivers, it's really important to cultivate time that's going to feed your soul, your inner spirit, to make yourself happy and to have moments of joy to help replenish, what's been depleted.
Yes, and this program actually helps you develop that personal plan for yourself. And a lot of times when we write things down, you start realizing just how little time you actually share on your own. I know I've had a few times with caregivers when we started writing down just how much time they're actually providing care. you actually get over 24 hours. It sounds crazy because mathematically you shouldn't be able to do that, but you realize that one task rolls into another, rolls into another, rolls into another, and eventually you realize that you have absolutely no time for yourself.
Mm-hmm.
And that's a big issue when you don't have any time to be able to explore your own feelings and to really find your own mindfulness and your own peace. Caregiving is not going to be able to work.
Mm-hmm. Yeah, it's very important. I was reading somewhere how caregiving or caregiver burnout, the two root of this problem is lack of personal boundaries and also feeling guilty about saying no. Mm-hmm. So those two strong components, boundaries and being able to say no, it's the very root of compassion burnout, especially if it's the informal setting, which is family, friends, neighbors. The formal setting, which what you mentioned, the professional one, where you get paid and you can clock out and go home to your home and take care of what you need to take care of. The informal one, you're living with that particular individual, and that individual needs you more than 24/7, as you mentioned, and that can be so depleting physically, mentally, and emotionally on the caregiver's part.
And it can also be the problem where you don't identify you're even caregiving, because when you're in the informal setting, it is really the drive that you just feel that you have to do it and you should be doing it. And then you don't mark it as a caregiving job. And that's another thing we kind of tease out is what actually is caregiving, what is the role which you're taking into place, and what is changed from what maybe things were 10 years ago.
Mm-hmm. So, based on that program, what is the definition of caregiving, and how can people who are watching this right now determine, have I been very kind and been loving to, for my family member, or have I crossed that line of caregiving?
It's a very challenging thing to say in a kind of a nutshell environment, because every place is a little bit different and every person's a little bit different. But the rule of thumb is this: if you're finding that you're needing to do something for someone else and there is a need rather than a want. Now, I explain that a little bit clearer. If you're going in and you're finding that your spouse cannot put their shoes on anymore, and you're having to put those shoes on every single day, that is a need. That is no longer a want. Now, they may have asked you in previous times, hey, can you help me with my shoes? But if you're noticing that there's not the ask to just be helping, it's a requirement, that would be an early warning sign of, okay, we're moving into the next phase. We're moving into a caregiving role. Mm-hmm. Mm-hmm. Now, another example of that would be when you go to a doctor's office. If you're finding that maybe your spouse or your family member is requesting you to sit in on a doctor's office appointment more, that would be a shift from being just there to support and to being more of a caregiving role. Now, it may sound very kind of, how can I put this? Non-definite, non-defining, but that's really where the issue is, because every person is different and every person baseline, as they call it, psychological baseline, that is the official term, is different. So you need to look at it, and that's where, again, we will work together as a group to find out what the person's baseline was. Was the baseline something which is as simple as putting on shoes and taking off shoes? Or was it more complex, where like you're needing to do more emotional care? Like, are you finding that the person gets overwhelmed when they go shopping now? If they go to the grocery store and they can't do that because they're getting too overwhelmed, or they physically can't get to the grocery store, that would be another kind of alert, like, okay, I'm in more of a caregiver role here, because I'm not only supporting them to go to the grocery store, but I'm also supporting them because they physically cannot take that step into the grocery store due to either anxiety, frustration, or forgetfulness.
Mm-hmm. Very good point. So it's something that a person who is doing these kind deeds should kind of process and just kind of reevaluate each time that they're doing something, not to calculated or just to be impersonal, but in order for that particular caregiver to, or that person who's doing the kind deed, to kind of realize, okay, where are we heading? Is this getting to be a more of a routine? Is there a dependency here? Are there more tasks that's being asked? Are there more, do I need to start rearranging my own personal schedule in order to allow more time for this particular individual? So these are just things to think about, factors to think about, to determine if you are falling more and more into that caregiving role. And I can imagine if even if people are cognizant, if they realize that they are falling into that role of a caregiver, an informal one, not being paid, how it's important for that particular caregiver to determine how much they're willing to take on. And again, that falls into the personal boundaries when they're willing to say no, so that it doesn't exhaust them and also make them feel like they're not being a good person.
Definitely. And I think, we go back to a term as well, which I like to coin very often. It has to be person-centered. So whoever is going into this, you have to be very specific on that person. And it isn't just a check-off box. I mean, the way you got to look at all these tasks that you're doing is it more than that honey-do list? Back when you started, in your relationship, or it was back when you were mom and dad, and this is your child, am I doing more on that honey-do list now than what I was maybe 6 months ago? And that's when you can also start looking at different assistants and different age groups. And there are many, many out there. And the 6-week program is developed to encourage you to find those areas where it can help you and just really kind of assist you with getting a bit of a break, and also finding out any further things that you may need assistance with as you move down the line.
Definitely. It's very important because one caregiver can't do it all unless they want to do it all, which is fine. But if you have your own life and you have your own responsibilities, trying to find different types of resources out there that can, help you do the work in a way that's going to give you more balance in life is just very key. Like maybe housekeeping or somebody to do the grocery shopping. And this, if the person is a senior, perhaps contacting the elder services to see what they qualify for. So that way, if it's a ride, maybe they can get a ride to that particular doctor's visit. Or if it's groceries or maybe Meals on Wheels. So, there's so many different types of resources out there that that can really support not only the person requiring the care, but also the caregiver themselves, right?
100% with that one. Yeah, I mean, the resources are very vast, actually. I mean, there's a lot, especially in the state of Massachusetts. We're lucky to be in this state. We have the ability to be able to tie into many different local resources, local areas. I mean, if it's something as simple as food, I mean, we can actually go to food pantries that can actually assist with delivering the food. We can look at, the Meals on Wheels program. I mean, that is something that many people are aware of. But there's also transportation programs which is similar around the Meals on Wheels. So even if you don't want to go in the old-fashioned wheelchair bus, which there is a stigma around, there are actually private cars still which are actually doing that now. There's livery services, and there's other developments which really you can get tied into depending on the level of care that is needed. So that's, again, it's a really big part of this program is to find out what you really need. And once you have your needs list, we can work together to be able to find a way to solve that.
That's wonderful. Wonderful. Because as a caregiver or for caregivers, it's important for them to realize that they also have needs, and those needs need to be met in order for them to feel like a person. Because you talk about person-centered approach to be able to take care of that particular individual who needs the care. But as the caregiver themselves, they need to remember to take on a self-compassionate lens to be able to help themselves feel whole and complete, so that when they're there doing what they need to do for their family member or friend or neighbor, that they feel they know who they are, and they're able to do it with more love and compassion.
Yes, and I mean, I would also have to add to this, just on my injury prevention side of this, statistics do show people which are actually giving caregivers, they stop focusing on themselves, which means that they are at a higher risk to cause the injury. Whether it be as simple as like, actually, this is a great situation. Say that you have a person that needs assistance out of bed. You get frustrated one day, you come up and they wanted to get out of bed, you bend over, you don't use your knees, and suddenly there's your back out. Mm-hmm. There's your injury because you were fatigued and you were too frustrated at the time because you were in a caregiving role that you did not think, and you went straight into unfortunate injury. And then you're going putting yourself into the trauma cycle, not only the person you're caring for, but yourself is now in that cycle too. Mm-hmm. And these are, again, areas which we call red flags, and we want to make sure that we avoid at all costs.
Mm-hmm. Mm-hmm. Yeah, definitely. More important that caregivers take care of themselves so they could use proper body mechanics and just really taking good care of themselves so they can be healthy and strong. So you mentioned the other pillars of the powerful tools for caregivers: reduce stress, and then you talked about emotion management. We kind of skimmed around that a little bit. Can you speak a little bit more about emotion management?
Yeah, emotion management is focused on how we react to things. One of the things which we find when we're starting to talk, and we do a role play within the group about how we present our feelings through a sentence, and how word usage can be very different if you say the same thing in two different formats. Now, what that is really kind of saying in a very simplified format is like when I say, I want to be seen at X time, or I would like to be seen at X time, it sounds the same, but how you actually present it to either the person you're caring for or the caregiver or a medical professional, that shows the emotional content of that sentence. Now, to go a little bit deeper into that, it really is more focused on how we interact with medical professionals, because obviously we do run on emotions, and we go in and we feel that we are the only person that doctor is seeing. We feel that our pain is the worst that it possibly could be, because it always is going to be the worst because it's ourselves. So what this program redevelops is how we actually can break these things down, keep our emotions kind of out of it, and actually really give an accurate description of how we're feeling to not only medical professionals, but to also our caregivers, as vice versa. Because a lot of times that communication piece falls, and we don't really say what we mean to the person who's taking care of us, or vice versa. We could sometimes have that kind of fake smile, they call it, where it's like, oh yeah, I'm fine. I can tell you that F word is the worst word in the language. Because if someone tells you they're fine, 90% of the time they're truly not. They're actually asking for more than what you're actually giving, or they feel they can't ask for that. So it is a very broad term, emotion management, but it is trying to focus on how you present your emotions effectively without hurting someone.
Mm-hmm. Can you give me another example?
The fine one is probably the best one I can say for both ways. Like if I'm talking to my wife, and my wife has, been really kind of challenging me for, say, the past 6 months. And she asked me to go to that one last task, and I'm going, okay, I can't do it. Now she gets angry at me, and she just says, why? And you just say, I'm done, I just can't do it, and walk away. Now, that was me trying to hold back my emotion, because I don't want to hurt her and say, you know what, you've been nagging me about this for this, this, and this. But she now feels more upset because I've ended it in a very concrete form. So I've not really shown my emotion in that sentence. What I've shown is I've cut my emotion off and walked away. Now, emotionally, I could say, okay, I'm going to talk to my wife and say, okay, you have been asking me a lot of things the past couple of months. I just need some time for myself. I feel overwhelmed. Now, you're going to get a lot happier of the conversation started there and a lot more understanding before you move on to the next step. And hopefully you will actually stop that feeling of guilt on either person. And that's really the goal with how you're wording these things, is to stop that guilt. Because we try to be as, professional, or professional is the wrong word. We try to be proper with our language use. We try not to hurt people. We try to word things in a way that we feel might be the correct way at the time. But when you start writing these things down and start like role playing it, it's really not what is working at the time. And you find that a lot of times we end sentences without a actual finalization. So you don't actually figure out or resolve the situation at all. And you actually end up with that emotional guilt still in play. But when we go back in the same sentence and explain why we're doing the situation and why we feel the way we feel, that emotion management structure goes into play. And you can actually work things out and you can resolve when there's a problem. Because the person that you're talking to can also then have a good conversation back to you and say, well, I didn't really realize I was asking so much from you. Can we maybe find a better way to do these things moving forward without getting you so upset? So that's really the kind of the premise in a nutshell. Yeah. I mean, we actually work on that for an entire 2 weeks and we continuously work on it. One of the things which is part of the initiative is we work on how we prep for a situation for the next week. So we'll choose a situation and then you will actually work how you would deal with that and what you would talk about and how you would reach out for different aspects of resources. And it's a very structured format that is utilized, but you can develop a program that works for you around that structure. But it's very interesting when you actually work it through in those levels and realize just how that other person is feeling when you're talking to them.
I love that. I really do, because, and for you to say that 2 weeks is spent on, it sounds like it falls into crucial conversation land where, it's hard for a lot of people to just express themselves without having the frustration or the emotion to fall into that. Or sometimes people just clam up and just, they'll just they'll just be so frustrated and angry and just do whatever the other person is asking to do. And they have that regret and anger pent up inside. So for people to really learn how to word things and to kind of give themselves a space from their own emotion and stress, and to be able to be transparent and share what it's been like for them, and to be able to, in a way, like tell that person who's been requiring the care what the demand has been recently or for the last week or last year. It's a nice way to kind of open up that dialogue. Yeah.
Yeah, and that's the idea behind it, is to open up that dialogue. The other thing which I think we all need to be mindful of is we can have cultural and generational aspects to this. When you're looking after your parent, there's a lot of times you don't want to be having that conversation, but you have to. I would say the most awkward one I ever had, I remember with my family, was personal hygiene and talking about UTIs. Now, me being from the healthcare field, I could talk to my mother about that before it was going on, and I could be very clinical about it. But there's a lot of people that don't have that ability. And that's something we kind of go into as well, is how to actually bring these things up to your person you're caring about. If it's someone of the opposite sex, how do you talk about those sort of situations before you go and report to the doctor? These are very awkward situations for many people to talk about. And when you role play it with other people, there's sometimes, a bit of a laughing going on because it's, subject matters that's a little humorous, but it gives you the strength to be able to actually move forward with those conversations in an educated fashion.
Yeah. Yeah. That's wonderful. Wonderful. And you mentioned it could be cultural. And what popped into my head is I wonder how it is different cultures, how they perceive caregiving. Does one culture perceive caregiving as caregiving, or does another culture perceive it as, oh, we're just taking care of our own family? You know, this is how it's always been. This is how we do it in our country.
Well, I can tell you from experience, and I think you may have some experience of this yourself. In certain parts of the world, it's a done deal that you will take care of your elders. I know in India, they will move in with you. You will take care of them until the point where they pass on. I know in Asia, same effect. A lot of African cultures will do that as well. They will always have that connection. Sadly, the westernized world, for all of the improvements that we did, we kind of lost a little bit of that. But I know coming from a European factor, we're still pretty strong on making sure that our families are tight, but not as much as I would say than, say, the Asian culture. I go strongly into like China. I know that they definitely have a strong connection within their aging population. And India. India, I have experienced myself personally. And yeah, it's a very tight and just a expected thing to do is to take in your elders.
Yeah.
Which has its own problems. As I'm sure anyone who's experienced it can testify to.
Yeah, I'm sure it has its own problems, and also it could have benefits, because if that elder moves into a home that has many different hands, then you have many levels of caregivers available. But, you know, there's always going to be a dimension where, you know, does that elder have dementia? Does that elder have suffered a stroke? Do they have Parkinson's? Are they just not a very nice person? Are they depressed? So there's a lot of different dynamics that can happen. So there are some pluses and negatives to having a multi-generational home that really takes care of themselves. Also, same thing with an elderly couple who are aging in place in their own home, having one rely on the other, you know, that has benefits because they're in their own space. They're the king and queen of their home, but their body is just not as strong as it was before. So they need some support.
Yes, and I think one of the things which is interesting, why I was bringing up the other initiative briefly at the beginning, we're really trying to focus on bringing initiatives that encourage both partners to be part of it. And there's a reason to that. The methodology behind it is that we get to be able to discuss things in a fun environment. And then we can start these conversations. And I found through actually conversations through something like Bingo Size, we've started talking more about mental health. Now, that is a great conversation to start with, but it's also a very healthy one. And it's in a safe environment when you're doing it through an initiative similar to that. And I'm finding that not only just my department, but other injury prevention specialists seem to be on the same mindset as what I am, is really this is an all-encompassing thing. We should be looking after the caregivers. We should be looking after the person that we're taking care of, but we need to do it through initiatives that are open and not so structured to just the person receiving the initiative benefit.
Mm-hmm. Yeah, there are a lot of different initiatives out there and support and resources for caregivers. So it's important for them to take the time to try out different programs that may be, fun, like a Bingo Size, or maybe something, the program that you're talking about, the powerful tools for caregiving, or just maybe connecting with a friend or a family member for tea. So, everybody is different. Some people are introverted or extroverted. Some people are, they want that group setting support. Other people, they just want that one-to-one. But whatever it is that can really serve the need of the caregiver is very important. And also knowing the resources.
But also places like this is a huge area. Given an open forum and an ability to be able to explain what we're doing, I think is a great environment. And I do greatly appreciate you having me on today for that reason.
Thank you, Richard. I mean, when I created this program, Aging Strong, as part of my outreach for Tufts Medical Center, I really wanted to give voice to the fact that falls prevention is not just because somebody hasn't been exercising. And as you and I know, we have this collaboration with Beth Israel. We do a falls prevention program, and we always say that, falls are preventable. But just through research, and me as a person growing older and, being in the sandwich generation, there's so many different factors out there. There's so many different factors that an aging person has. It could be their medication. It could be because they suffered a stroke, or it could be, so many different factors that can make people or lead to unintentional falls. And that's why this particular forum, I want to be able to really give voice to what's out there. There's so many different information out there that we can take in and learn from, so that we are more prepared if we are going to be in that road of being a caregiver someday, maybe helping us be more prepared so that we can prevent any type of burnout or any type of situations that can be preventable. And there's so many different resources out there, especially now with, COVID, there's so many different initiatives, new president, he's really giving a lot of money towards the support of the aging population, which is great. So, as we have 10 more minutes, so whoever's on the call, if they have any questions, please ask. But I was also reading about the fact, this is beautiful here from AARP. They said family caregivers are the backbone of America's long-term care system, and that backbone is breaking because of the burnout. And not only burnout, they're finding that it says here 78% of caregivers incur routine out-of-pocket costs. So it's not only costly of that caregiver's time, but also their budget, their financial situation. So again, for us to have this dialogue here and really being transparent and sharing that there is such a thing as caregiving or caregivers burnout, and there are different support systems out there, like the one that you're offering us. Actually, you're offering us maybe two, like Bingo Size, which is, it could be turned into a more for a caregiver, but more for fall prevention, and also the powerful tools for caregivers. So learning about different resources out there is very, very important.
I'm actually glad you brought up the financial piece as well. If anyone on the call today wants to be tied in to a benefit specialist, that there is money attached to caregiving, but you'd have to go through a benefit specialist to find out what you're eligible for. There's no guarantee, obviously. I mean, I'm not a benefit specialist, but I can definitely help Debbie or anyone else on the call direct you through to people which may be able to help you in that area. So that's another reason why it's kind of important to know when you are changing from a relative to a caregiver. Because it's as you said, a family member is turning into the long-term care. So that long-term care professional, whether it be in home or not, does have some financial packages attached to that.
Mm-hmm. Yeah, it's very, very important to know that. And, as our role for our own hospitals, the injury prevention role, the programs that we offer through Council of Aging, independent living, assisted living, low-income housing, our programs are free, right, Richard? So if anybody has, are interested in, learning more about the tools for the powerful tools for caregivers, please reach out to Richard. Richard, what is the best way for people to contact you if they have more questions?
Now, through email would be our SHIP, which is SHIPP at bwh.harvard.edu. that would be the best way to be able to reach me on that side. If not, there is also a telephone line, which I will have to share separately because at the moment we are just changing our telephone box across and I don't have an active voicemail yet. But currently, if we go with the email and then we can change over once we have some telecommunication updates.
Mm-hmm. Wonderful, wonderful. Now, so with a few more minutes left, what are one or two takeaways that you want caregivers to gain from our time together?
I think the biggest one, there's no shame and guilt. There's absolutely no shame and guilt. If you feel that you're guilty, don't. You are providing a service that's very, very hard. It's not easy in any way, shape, or form. Be proud of what you're doing and just know that there is help out there. All you need to do is reach out. Mm-hmm. Yeah. And I would say the second thing is look at everything as open as what we possibly can. Try everything we possibly can. Go through as many initiatives as you could try. You never know what you might benefit from them. And the fact that you're on this call today shows me that you are definitely wanting to learn and wanting to see what is out there. So let's show you what is available.
Mm-hmm. Yeah, there are many different programs out there. Yeah, it's very important for caregivers to give the care back to themselves and receive care appropriately. So definitely. So Richard, thank you so much for being here today. And I look forward to working more with you in our falls prevention initiatives. So once again, thank you all. Thank you for being here. Be well and stay safe. Thank you, Richard. And thank you to Thomas Crane Public Library and QATV. Bye-bye.